old days, we had aerobic exercises as one of the pillars of type 2 diabetes management, for that matter any diabetes management. But for the last decade, what we've noticed is resistance training has become the game changer, and aerobic exercises, when used synergistically with resistance training, is going to drastically help with reduction in the HbA1c. We have with us Dr. Alice Brown. She's a scientist, she's a strength training expert, she's a certified strength and conditioning specialist with a vast experience in the fitness world and with a lot of publications. Welcome, Dr. Brown, and I'm really, really excited to have you with us today.
Thank you so much. I've been excited about coming on the show.
Yeah. We are here at the Five Rivers podcast, and I'm really looking forward to a lot of insights in the fitness world in regards to type 2 diabetes management. And my first question for you would be, what led you to explore resistance training in type 2 diabetes?
Yeah, so one of the awesome things about being a researcher in academia is that we get to study whatever we're interested in. And so with resistance training, which is basically strength training, I've been doing it ever since I was old enough to get a membership at my church. So 14 years old. I've always been into strength training. It wasn't until my late 20s when I was doing a master's degree that I started getting proper mentorship by powerlifting coaches, Olympic style weightlifting coaches. And at that point, I started getting interested in going into strength and conditioning. And so one of my mentors at the time, Dr. Lon Kilgore, he said that if I was wanting to go into strength and conditioning, I needed to first learn the Olympic style lifts. And so I'm originally from Louisiana. I was in Texas at the time. So he sent me back to Louisiana, to Louisiana State University in Shreveport. They've had one of the best weightlifting programs in the country for quite some time. And so what was supposed to be a 3-month internship turned into a 2.5-year internship because I started getting into competing and just really loving the sport. And so I competed in Olympic style weightlifting for about 6 years. So I competed at the national level in the US, and then I competed in Scotland for a little while too. And so once I finished with my PhD and I started my work at Oakland University, so I'm an associate professor at Oakland University, which is just outside of Detroit, Michigan. I was trying to figure out exactly what research area I wanted to go into. And I'd gone to a conference over in Dublin, and I ran into my PhD chair, and I was talking to him about it. And he just casually said, "Why don't you work on the resistance training prescription for diabetes?" And I was like, "Oh, that needs work?" He said, "Oh, yeah." So I was like, "That sounds perfect," because my dad has type 2 diabetes. And so I already had an interest in working in type 2 diabetes. I just didn't know how I was going to fit into it. And so ever since that meeting, I've dove in headfirst into anything and everything that has to do with resistance training and type 2 diabetes. And so I've got several publications at this point related to resistance training and type 2 diabetes. Like we've established grip strength cut points for adults and youth, so we can actually estimate whether or not somebody has type 2 diabetes or increased cardiometabolic risks based solely on their grip strength and body weight. We've also published a meta-analysis and then a separate review on resistance training interventions in people with type 2 diabetes and how they impact cardiometabolic outcomes and lean mass and strength outcomes. And then one of my recent papers, we published some proposed movement pattern definitions for resistance training. I'm really excited about this. And the reason is, like right now, the way that resistance training is, the recommendation to prescribe it is based on muscle groups. Train all major muscle groups at least 2 to 3 times a week. So that's the general recommendation. One of the challenges with that approach, though, is not everybody knows what muscles they're working during an exercise, right? So if you're doing a movement like this, that's a rowing movement. People might think that that's just working their arms, whereas the main muscle group that works is the back. The biceps work too. So we've proposed movement pattern definitions to use instead of muscle groupings. So instead of saying work your chest and your triceps, we would say horizontal pushing movements, which seems a bit more intuitive to be able to identify just ways that you're moving rather than specific muscle groups. So yeah, that's where I'm at now. And a couple of years ago, COVID inspired me to start a YouTube channel for people that it's geared towards people in the fitness industry and also those in the diabetes community. So I have, because one of the issues that I noticed during COVID was a lot of people with type 2 diabetes, they either don't have access to a gym because a lot of gyms were closed, and if they do have access to a gym, they might be more concerned about having an increased risk for infections. And so I decided to start this YouTube channel. So I have exercise education videos. I have exercise instruction videos. So I show you exactly how to do a strength exercise, and then workout videos for people with different levels. So the intent was to provide as many resources as I could so that people could independently get in their strength training workouts from home.
I would say that's really, really impressive. And I'm really looking forward to learning a lot of this from you today. I want to put it out there that, as doctors, what we end up doing is, as prescribing physicians, we just say that, okay, go and do this exercise, like do cardio, like 150 minutes per week, or you need to do resistance training 2 to 3 times per week. But then really what the meaning of it is, we're not able to give that information to our patients. And like you said, you're working on those movement patterns, and that really is going to simplify things for a lot of people out there who don't really understand much of it, and it's going to make life much easier in terms of going forward with resistance training. And I'm really looking forward to what all is out there, like, and what are we going to explore in this podcast. Thank you. And we'll move on to the next section. So, Dr. Brown, can you elaborate what it is when we talk about resistance training? Let's just go into very basics and understand when we say let's do resistance training, and when we tell people out there, what does it really mean?
Yeah, so resistance training is just a general term for a general type of exercise that's used to increase muscular strength and muscular power. And so, muscular power, all that means is it's a combination of strength and speed. So, being able to move loads in a quick manner. And there are multiple ways that you can perform resistance training. So, it's also called strength training. If you've heard the term weightlifting or weight training, those are specific types of resistance training that involve weights. So training implements like dumbbells, barbells, kettlebells, those types of things. It can resistance training can also, or weight training and resistance training can also include machine weights. So if you go into a gym and you've got machines where you do like a press, different pressing exercises or leg press, those are considered weight machines, which is also resistance training. It also includes different body weight movements that are intended to increase strength. So if we're talking about push-ups, doing air squats, sit-ups, those types of movements, that's all considered resistance training. And then what I've really been getting into the last year or so is resistance bands. So resistance bands is another form of resistance training. And one of the things I really like about them is they're affordable. People can afford a set of resistance bands for like $50 or so, and you can do a ton of different exercises at home with resistance bands. So yeah, those are all the different forms of resistance training, and just the main purpose of that type of exercise is to increase strength and power.
And there are a lot of words in terms of endurance training, circuit resistance training. Would you want to elaborate on those as well?
Yeah, so circuit resistance training or circuit training means that you are basically doing a set of one exercise. So let's say you do a bench press movement for It's usually done for a set period of time or a set number of reps. So let's just say you do 12 reps and then you move on to, so it's basically a circuit. You move on to another exercise. So let's just say it's lunges. You do 12 reps of that, and then you move to another exercise. So you've got this full circuit, typically of about 8 different exercises. There's a specific rest period in between each exercise that you do. And so that's a really great way to increase muscle size and also decrease body fat, because you're not allowing yourself much time to rest. And especially if you include multi-joint movements, meaning that you're working multiple joints, multiple muscle groups at the same time, it's just more bang for your buck.
Hmm.
And then you said circuit training. What was the other one that you had mentioned?
Endurance training.
Like cardio, you mean? Like aerobic endurance, or?
I mean, in general, like the term endurance training is used for what purpose?
Okay, so if we're talking about endurance training, usually that has to do with aerobic fitness training, or cardio is the common term for it. So with cardio, um, you're using large muscle groups that are doing movements in a rhythmic fashion continuously. So with weight training, you do a few reps and then you rest for a little while. You don't do that with cardio. It's continuous movement. And so that would be things like going on a brisk walk, doing some swimming, going for a bike ride, those types of things. And fitness adaptations are, I mean, you can train for muscular endurance, if you may have been hinting at that. But they have different adaptations. So you would typically train for endurance or aerobic endurance if you're trying to improve the ability of the heart, the lungs, and the blood vessels to distribute oxygen to working muscles. So essentially increasing your aerobic fitness or your aerobic endurance.
Um, that's a very elaborate definition of endurance training that you gave, and resistance training, which is excellent. So, moving on, like, if we were to talk about in reference to type 2 diabetes management, how would you describe the benefits of resistance training in type 2 diabetes management versus endurance training or aerobic exercises? And how should we combine the two to get the maximum benefit?
Yeah, so like most of the research has found that the most effective exercise programs for type 2 diabetes, it's going to be a combination of cardio and strength training. Um, and so both of them are very, like, they share common benefits, but strength training does have some added benefits that I'll talk about in just a second. But with both of these types of exercises, both are very good at improving glucose management, so ultimately reducing A1C. They're both very good at improving insulin sensitivity, blood lipids like triglycerides and cholesterol, endothelial function, which is one of the main markers of cardiovascular disease, and also reductions in visceral fat. And so visceral fat, that's the fat that we found that surround our organs, and it's increased visceral fat is highly correlated with type 2 diabetes. So both of those exercise types are very good at improving these cardiometabolic outcomes. Now, some of the added benefits that resistance training has that cardio does not is, number one, muscle hypertrophy, meaning that it helps to increase the size of the muscles. Now, that's real. I know women a lot of times get a bit cautious when they hear increase in muscle size, but trust me, it is important for your health, especially when we're talking about type 2 diabetes, because one of the unfortunate consequences with type 2 diabetes is muscle wasting. And so resistance training is the only thing, resistance training combined with appropriate protein intake, I'll say, is going to be the most effective way to combat that muscle wasting and increase muscle size, because you have to think of muscle as being this metabolically healthy tissue that you need for better body functioning metabolically. So muscle hypertrophy is an added benefit that cardio doesn't have. Also increases in bone mineral density or bone mineral content. So resistance training helps to strengthen your bones. That's really important, especially as we start to get older and fall risks become more of a reality. So if you've got stronger bones, you're going to be less likely to fall. And if you do fall, you're less likely to, the fall is less likely to result in a fracture if you have higher bone mineral density. And then another point is, in type 2 diabetes, neuropathy is an issue, right? The longer you have diabetes, your risk for developing neuropathy increases. And once you've got neuropathy, that's what really starts to throw off your balance. And so resistance training is really good at helping to improve balance. So the two main muscle groupings that are related to somebody's ability to balance are going to be your lower body muscles and your core, your abdominal and your lower back muscles. Let's see. So other than that, um, so with also, if you're doing the exercise movements, the resistance training movements through a full range of motion, that can also help you maintain and increase flexibility. So range of motion around the muscle joints. I think that's, yeah, I think that's it.
I was reviewing a systematic review and meta-analysis from 2022.
Mm-hmm.
And what I found was, there's a drop in HbA1c by zero point 0.5 or point anywhere between 0.39 to zero point 0.5, based on the paper that was studied. Like different studies reported differently, but then like when synergistically there was a better improvement. But
Mm-hmm.
then again, these studies were not very long term, the ones that, so it is probably hard to say. And what I would say is, like, for resistance training, and correct me if I'm wrong, I would say it would show more in the later stages, in terms of your maintenance in the glucose control and maintenance of the HbA1c. Once you've built that muscle, once there's a initial
Uh,
decline, um, I mean, would that make sense to you?
I see, because it takes a little more time to build the muscle to help increase the insulin sensitivity, maybe. But there are other mechanisms in place for increasing insulin sensitivity other than the muscle hypertrophy. So one of the mechanisms is through, because resistance training reduces visceral fat,
Mhm.
and the inflammation that's caused by excessive visceral fat impacts insulin resistance, or it contributes to insulin resistance. Resistance training, since it does help to decrease that visceral fat, that's one of the mechanisms that aids in lowering A1C. And then it's also the intensity of the exercise too. So the higher the intensity of the exercise, that's been linked to more favorable cardiometabolic outcomes, including better glucose management. So,
Mhm.
so yeah, there's a few other mechanisms other than the muscle hypertrophy.
Right. And if you were to, so for a certain age group, beyond 60, beyond 65, when we know that sarcopenia starts to happen, and when there's muscle loss, would it be more beneficial to work on resistance training rather than aerobic exercises, because of their limitations in doing those aerobic exercises as well? But then I also find like the other spectrum to it, where a lot of people would just go for walks and do brisk walks, but then still they're not able to achieve their good HbA1c. So, I mean, what I'm trying to say is, would it be just better off doing resistance training alone, versus would it be a combination of both in a certain age group which is not able to keep up with their muscle loss?
I think it would be beneficial to do both, but how you would structure that program, I would say doing the higher end of the resistance training. So doing 3 days a week resistance training instead of just 2 days a week, because they really need to be, no matter what age they are, they need to be exercising most days of the week. Because we know that after an exercise session, whether it's resistance training or cardio, blood glucose is going to stay suppressed for up to 24 hours. So it's important that they have that frequent movement, frequent exercise, regardless of what type of exercise it is, to keep the glucose managed properly. But yeah, I would definitely say like increase the make sure that you're doing resistance training 3 times a week instead of the minimum of twice a week. And also with the like I think the walking is important because that's an activity of daily life, right? And so we want them to be able to maintain that ability to walk distances, and the only way to
Right.
maintain it is to actually do it.
That's absolutely right. And but there's a lot of scare when we talk about resistance training, and you mentioned intensity. So maybe if you can clarify certain terms like repetitions, reps, number of sets, intensity, rest interval. What do they actually mean, and how do we implement it when anybody's about to start a program for the first time?
Yeah, so first term repetition. So that is the number of times that you're doing a movement within a single given set. So if I were to sit here and do 10 chest presses, that means that I did one set of 10 repetitions. And let's see, we said sets, reps, intensity.
Intensity.
Yeah, so intensity is if you're using weights, it's the amount of weight that you're using and relative to how much you're actually able to move. So if you're working with a trainer, they're going to, well, not all of them do this, but the scientific way that it's done and definitely done in sports performance is you base intensity based off of your percentage of one rep max. And what that means is you would first have to do a max test to see how much weight that you could move safely for a single rep. And then you would calculate a percentage of that one rep max. So like 60% is usually on the lower end. But most people aren't going to do that. If you're just starting an exercise program at home or at the gym and you're not working like in a tightly controlled environment for your strength training program, which is most people, it's really just to go on good to go off a feel. And when you first start off, like especially the first 2 weeks, I would say first week, just get in there and just focus on light to moderate movement. So you're getting comfortable with what you're actually doing, the movement that you're doing. And I do think it is really important to keep a record of everything that you do. I've got a little notebook that I take with me every time I train. I list the exercise that I'm doing, the weight that I used, how many reps I was able to get, because the whole point of resistance training is you're trying to get stronger, right? And so I don't know how good everybody's memory is, but my memory's not that great. So that's why I keep a notebook so I know exactly what I did the previous week. And if I see, okay, I was able to lift this weight 8 times last week. Let's see if I can increase it to 10 times this week. Or, hey, I've already done 10 reps last week, so I'm going to increase the intensity this week. And the intensity that you want to go at, for most people, you typically want to build up to a moderate to high intensity. So it does start to feel hard towards the end, but the first 2 weeks, you should really do a transition period and like slowly increase, like it is a marathon. You want to slowly increase that intensity. And when you're first starting off, it's really exciting because you're going to have strength increases every week for quite a few months. And you'll eventually get to the point where you plateau and you need to change your program up a little bit so that you continue to see strength gains. But it's very motivating when you're first starting to train, because if you're keeping record of all this, you can see yourself getting stronger week by week. Because a lot of people, when they come into the gym, one of the main goals is fat loss, right? And weight loss takes a while. So it's not that motivating every day. You've done all this work and you don't see it on the scale. But if you're focusing more on your strength training outcomes, so how much you're progressing in that way, to me, it's a lot more motivational. Um, and so with the intensity, when I'm talking about high intensity, you want to make sure that you are performing as many reps as you can per set with that given weight in a safe manner, to the point where you do it within one repetition of failure. And what that means is if it's getting really hard on a rep, and I think in my head, if I try to do one more, I'm going to fail. Then that's the end of my set. Like I was able to complete that last rep, but if I think that it was so hard that I'm probably going to fail on the next one, You could definitely try it and see if you get it or not and surprise yourself. That can also be fun. But just that's what I mean by doing it at a higher intensity. So doing it within 1 to 2 reps of failure.
Hmm. And what about the rest days, or probably pauses between the sets? So how do we approach that?
Yeah. So rest between sets, it really depends on what your training goals are and what your what intensity you're working with. And when I'm saying, well, actually, when I'm saying intensity now, I'm meaning it more as so rep ranges and intensity are very closely related. Meaning if I'm moving a heavy weight, then I'm not going to be able to do as many reps with it. But if I'm moving a lighter weight, I can do more reps with it, right? So those are two closely related variables. And so if I'm doing a higher rep range, like let's say around 10 to 12 reps, it doesn't require as much rest in between sets as it would if I were doing a heavier weight with low reps. So if I was doing rep ranges of about, let's say 10 to 12 reps, which is typically a good rep range for people with type 2 diabetes, because that's going to be ideal for building muscle mass and also burning fat, then typically starting off 2 to 3 minutes rest in between each
Mhm.
set. When you first start off, you should have more rest in between each set. And as you become more fit over time, you can continue to reduce those rest periods. And that's going to have a stronger metabolic effect, not giving yourself as much rest all the way down to, for that rep range, um, probably about a minute and a half. I know that, and that's tough. Giving yourself a minute and a half of rest if you're doing 10 reps within 1 rep until failure. That takes a little time to build up to, but starting off, I would say generally about 2 to 3 minutes of rest in between sets. Now, if you move down to doing a heavy weight with 5 reps, then you're going to need more rest just because it's a higher intensity. And so that can be anywhere between maybe 3 to 4 minutes between sets. But you can
Hmm.
also kind of judge how you feel once again. And if you're new to this, it's going to take some time for you to get in touch with your body and how it's responding to resistance training and to understand when you start to feel recovered and when you feel like you can do another set and do exactly the same thing that you did with the last set.
Hmm. So if a person, so like you mentioned, this is if somebody is new to it. So if somebody is completely naive and has had a sedentary lifestyle and they're just starting off, would you recommend straight away going to 10 to 12 reps? And how many sets should they do? Is there a recommendation in terms of the weight that they start lifting? Or it's just based on the maximum intensity, like you talked about?
Yeah, so for somebody that's first starting off, I would say within if we're talking about the first week, I would do 1 set of each exercise done at a up to a moderate intensity. So what feels like a moderate intensity to you? You're not straining really hard, but it also doesn't feel super light. Yeah, because if we're talking about the percentages of 1 rep max, typically it's 60% of 1 rep max is what you would start off at a lot of times. But most people aren't going to do 1 rep max testing to know what that value is. So I'd say for just the average person, it's really going to go off of how the intensity feels to you, whether it feels really heavy, like you're really straining to get it done, or if it feels like a little bit of a challenge, but not too challenging. And I would say about around 10 reps, so 10 to 12 reps done at a moderate intensity. And so I'm recommending the 1 set for the first week because muscle soreness is a part of strength training. Fatigue is a part of resistance training. And if you do too much starting off, it can result in excessive muscle soreness, excessive fatigue. And I don't want people to get burnt out within the first 2 weeks because they did too much. So that's what I mean by kind of easing into it. So, yeah, they'll be fine doing 10 reps at about a moderate intensity, 1 set of everything, giving yourself about 2 to 3 minutes of rest in between each set. And then the next week, week 2, I would say bump it up to 2 sets of everything. If week 1 felt good, bump the next one up to 2 sets of everything. And you can do 2 sets of everything maybe for a month. And so you're focusing more on increasing intensity every time you come in. So if you did 10 pounds on the chest press last week, the next week, maybe bump it up to 15 pounds. So I would also advise against taking large jumps in strength increases. So just bit by bit, whatever the next weight is, just continue to progress every week.
Hmm. And is there a maximum in terms of, okay, this is the reps that I need to attain? Is this, these are not the number of sets, or I've reached my intensity to, X max, and I need to stop there and probably continue the maintenance phase rather than increase it further?
So I would say if we're talking about reps, I would cap it at 12.
Hmm.
If you do more than 12, it starts to get more into endurance training, and that's not the point of strength training, right? It can be beneficial in certain ways, but the point of resistance training is increase strength and power. And once you get past that 12 rep, you're training more for endurance, and it's time to increase the intensity.
Hmm.
What was the other part of your question? I'm sorry.
So even the intensity and the number of sets, like what is the cap in
Yep.
terms of the maximum?
Yep. So, with the number of sets, typically 3. So you want to build up to 3 sets of each exercise. And then intensity, you climb as high as you can climb. Um, and so I would say, like, once you get to the point where I'd mentioned earlier, you're going to have rapid strength gains when you first start training. So you're going to get stronger every month, or excuse me, every week, for quite a few months. And then if you want to maintain at that point, you can maintain, or you can change your program around a bit so that you can further increase your strength. Because strength is never a bad thing. The stronger you get, there's not a downside to it. And uh my my thoughts, I think, at least this goes along with my personality, is if I got to a maintenance phase, to me, it would just get monotonous. And so I like trying to figure out how I can change my program up more. It gives me variety, which makes it more interesting to see how I can continue to increase my fitness.
So how do we go about changing the program? Is it like, working on a different muscle group, which, I mean, if we're talking about a whole exercise program, we're anyway targeting all the muscle groups, or is it just the way we're doing it?
Yeah, so when you're changing up program variables, you can change up any of the program variables that we already discussed. You can change up number of reps, number of sets, intensity, rest periods, the number of days a week that you're doing it. And so what I like to do is periodization. So, and this is back from my competitive weightlifting days. So the way that they would prepare a weightlifter for a competition, and this is common across all sports, periodization is you change up the total amount of work that you're doing for a certain period of time, which allows your body to recover from all that work and get stronger. And so an example of that is the first phase it's called the hypertrophy phase or the high endurance phase. And this is when you're doing rep ranges of around 10. Okay. So, just like I was talking about earlier, and you're doing a heavy enough load that once again, you can only do it you're doing it to a point of 1 rep to failure or 2 reps to failure. So do that for 3 weeks, and then you can change up to another phase where it's more of a strength development phase. So you then, instead of doing 10 reps of everything, you increase the intensity or the amount of weight that you're using so that you can only do 5 reps of everything. So 3 weeks of that where you're really focusing on developing muscular strength. And then you can alternate between those 2 phases for a while. With the 5 reps, you're typically doing a lower amount of volume than the 10 reps. And so because you've decreased the overall amount of training volume that you're doing, that's going to allow time for recovery. So it helps you get stronger. And then you could do I mean, this is really heavyweight, but if you did even more heavier weight for 3 reps, that's typically what's called a power phase. And then you would include some movements that would focus on speed. And that's actually really important for older adults. So I don't remember whose meta-analysis this was, but it was comparing traditional strength training to power training, which the power training it's similar to resistance training, but you're focusing on speed of movement. So if you were to do a chair squat, you would slowly squat down to the chair and then rapidly stand up. And they found that power training it's better for older adults than traditional resistance training because it helps with fall reduction. So if you're about to fall, if your legs have good power, you can more quickly move your leg to stabilize yourself to prevent that fall.
Hmm. Wow, very interesting. Very, very interesting. So I think that's probably what the world needs to hear in terms of like how elderly people can help with fall reduction, and how we can use the daily ways without using weights, um, in terms of helping with muscle strengthening. Dr. Brown, I really want to also understand. So, there's the equipment that we're using when we're talking about resistance training, but also what about like without equipment? You already touched upon it just now. How would you go about building an exercise program or a resistance training program without using weights?
Yeah. And so you can start, like, if you're starting from the home and you don't have any strength training equipment, you can use everyday household items. And I actually meant to grab some for display, but just like a canned good, so a can of vegetables, you can start off with that. You can start off with water bottles as a resistance. Some other ideas, if you've got a backpack, load it full of books or water bottles, and that can provide a resistance while you're doing leg exercises like squats or lunges. But starting off, especially with somebody that has type 2 diabetes who's already going to have a reduced exercise tolerance, body weight exercises are a great way to kind of ease into resistance training. And then, because depending on your fitness level, it may be safest and most appropriate for you to either start off with a chair squat where you're just squatting down to a chair, or an air squat. Or once again, if you've got the backpack full of books or water bottles, you can do a squat with that to continue to increase the intensity. There's different variations of push-ups. So once again, if you're starting from a place of limited mobility, like what I'd do with my dad, I would do virtual personal training sessions with my dad, and we would always do wall push-ups. So you would go stand against the wall. Whoops, pushing the microphone. Uh, and so you would basically just kind of lean into the wall and then push yourself off of it. Um, let's see. Lunges are great, and that's another one that you could load with a backpack full of books. Um, if you do want to make a little bit of a purchase, the resistance bands, you can do a ton with the resistance bands. Like a lot of the exercises that you would do at the gym, you can do with resistance bands at home. So if you know what a lat pull down is, so you grab a bar and you pull it down like this. So it's a vertical pull movement. If you've got resistance bands, you can get what's called a door anchor. It's like $8 on Amazon. So one end of the door anchor is just pieces of foam, and the other end is just a piece of fabric that's in a loop. And so you basically close it into a door so that the fabric is on the side of the door that you're on. You loop your resistance band through it, and you can do just all kinds of exercises that you would do at a gym.
Wow, that's such a useful information. Um, So my question was also like you mentioned backpack. Now with the backpack, would you say there's a risk for back injury as well? I mean, or like a much higher load on the back for people who have a lot of a poor core build up, or like their back is weak. Would you recommend, or are there any prerequisites? I would just rephrase it, like before somebody considers doing certain exercises, which they're about to start at home.
Yeah, I think it could probably be a progression for people. So after they've built up some core stability, they've already got a baseline level of back strength. They've already progressed past air squats where they need a little bit more resistance to add to them. But yeah, I think it would be fine. And if you got a backpack, just start off with a really light book in it, right? And so you can just kind of build from there.
Slowly build it up.
Yeah, so
Okay.
it's all about progression.
Got it. Okay. What about rest days? So we touched upon rest periods in between reps or sets. What about days of rest? So somebody who's like had real muscle soreness, would should there be a prolonged rest period versus like the other person who's not had that much of soreness? Maybe they can just start off after one day.
Yeah, and so typically, if you're doing a full body workout, um, you want to give yourself 1 day of rest in between those workouts, and to further help with the muscle soreness aspect, those first 2 weeks, maybe start off just doing 2 days a week instead of 3 days a week. Just once again, just so that you're not too sore that you don't want to come back to the gym again. That's the last thing that we want to do. Um, so yeah, always give yourself a day of rest because the exercise session itself, you're breaking down muscle tissue. It's a heavy stress on the body. It's considered a good stress, but it is a stress on the body, and you have to have a certain period of rest after that stress on the body to recover. Because those rest days, that's when your body is really recovering from that exercise session and rebuilding that muscle that was just torn down.
Lovely. Okay. And I want to touch upon the aspect of type 2 diabetes back again. And I want to understand, like, in your experience or in your publications and people you worked with, how much of it has, like the effect of HbA1c? What is the degree of effect of HbA1c that you might have noticed in them?
The degree of change.
Yes. Yeah.
So there was one meta analysis that was looking at resistance training interventions and how they impacted visceral fat. No. It was total body fat, and they were able to they were able to estimate how much total body fat was linked to a certain reduction in A1C from resistance training. And so they found that for 1 pound of body fat that's lost, not body weight, because sometimes people lose muscle mass too when they train if they're not taking enough protein. But 1 pound of body fat that's lost, there's a reduction in 0.2% A1C.
Hmm. Yeah. And any point reduction in A1C is a good reduction in A1C
Absolutely,
for sure.
absolutely.
Yes, yes. You talked about protein, that, if they're not taking enough protein, would you want to elaborate on the nutrition aspects? So before starting the resistance training program for a person who's just newly started it, and while they're in the progression phase, how do you maintain that nutrition and the protein aspect of it?
Yeah, so the guidelines for people that are exercising for protein, it's between 1.2 to 1.6 grams of protein for every kilogram of body weight for that person. Um, so for the general public that's not exercising, it's zero point 0.8. So it's a little higher for people that are performing resistance training. And so, one easy way to try to make sure that you're getting in all your protein is every meal that you have, try to make sure you're incorporating at least 20 grams of protein in that meal. So that's a good trick to try to make sure that you're getting enough throughout the day. Making sure that you're having it right after a strength training session. So once again, once you finish with a strength training session, um, ingesting protein as soon as possible is really going to help to kickstart that recovery process for the muscle. So ideally within 2 hours after the exercise session, it can be a protein shake or it can be a meal that includes protein and some type of complex carbohydrate that will help to replenish some of the glycogen stores.
Okay. And so in general, we're talking about 1.2 to 1.6 gram per kg body weight of protein intake for those who are on a resistance training program. And also you talked about a very important point that right after the resistance training program, within 2 hours, uh, we need to take protein, which is so the same amount, would you say? The same amount of protein?
Yeah,
So
so
20
same.
grams,
Yeah, so minimum of 20 grams.
20 grams at that
Mm-hmm.
time. Okay. What about hydration? Like, how do we ensure that, the hydration is maintained, and what are uh, when do we consider, maintaining that hydration in terms of before and after the workout?
Yeah, so we know that when you get dehydrated, that can cause a blood glucose spike, right? Because you've got less water in your blood, and so the glucose becomes more concentrated, and exercise itself is also going to cause some dehydration. Your muscles need water in order to contract and to work. So make sure that you're drinking plenty of water before the exercise session, during the exercise session, after the exercise session. And just a simple way to make sure that you're hydrated, meaning that you're properly hydrated, is to check your urine color. It should be the color of straw, so like a really pale yellow. If it's clear, then that means that you're overhydrated. It's called hyponatremia, and there can be some risks in more extreme forms of hyponatremia, because what that means is, because you're so hydrated, your blood is the calcium content, or excuse me, the sodium content of the blood is diluted a bit, and so it can cause some issues in just general body functioning.
And what about, like, in general, like, so we're about to start a resistance training program. Is there a set guidelines in terms of changing the amount of carbohydrates or changing the amount of protein, apart from what you've talked about, like maybe 48 hours before, just, build your carb protein before you're about to start? Is there any sort of this direction that we need to think about?
So I'll say I'll talk a little bit about so my professional organization that my personal training certification through is through the American College of Sports Medicine. They're number one in the world for exercise and chronic conditions. And so I'll talk a little bit about that. And then I'll also talk about a little from some of the latest research that I've seen. So what ACSM recommends is, having some type of carb rich snack 1 to 2 hours before you exercise to try to prevent hypoglycemia. And also making sure that you get carbs. And same thing, like after the exercise session, if your blood glucose has dropped below 100 milligrams per deciliter, then they recommend having some type of carb rich snack. And they also recommend having like a fruit juice on standby during the exercise session in case your blood sugar drops too low. But what I've also seen recently, because I did a video on this a couple weeks ago, it was on people with type 2 diabetes. The study looked at people with type 2 diabetes who exercised in a fasted state versus a fed state. And now this was a walking intervention, so it wasn't resistance training. I haven't seen a study like this done in type 2 diabetes yet where they use resistance training, but they had two separate groups. Both groups were type 2 diabetes. Both groups did walking 3 times a week for a total of 150 minutes a week. So they were meeting the physical activity guidelines. The only difference between the two groups were, one group was doing the walking before breakfast, so they were doing it in a fasted state, and the other group did it after breakfast. And at the end of the 12 weeks, the group that did it before breakfast in a fasted state had significantly lower A1C levels. So we've
Hmm.
got what ACSM recommends, and then we've also got what some of the latest research is saying.
Right. So, I mean, these could be people who are already on medications and probably also insulin. So, their risk of hypoglycemia is there. So, we do want to make sure that they're maintaining those safety guidelines.
Mm-hmm.
Uh, what about in general, like if a person has prediabetes, um, is there a recommendation in terms of using carbs before, like 1 to 2 hours before the exercise, or like a person who does not have diabetes or prediabetes?
Um, I I don't know about general recommendations, like nutritional intake surrounding exercise for prediabetes or even the general public. I know there's a lot more research that's been done on exercising in a fasted versus a fed state in healthy populations. Um, but I've been so entrenched in the diabetes literature. I
That's
don't know if I know
fine.
offhand.
That's fine. That's fine. So and so even talking about resistance training, it's more. I mean, would it cause hyperglycemia? I mean, what we've seen is anaerobic exercises would cause a glucose level to be high. And if cardio is used in combination with resistance training or anaerobic exercises, then we are able to maintain that glucose level. Versus only aerobic exercises, there's a chance if you are on medications for type 2 diabetes, then you may end up having a low blood sugar either like an hour or two after the exercise, or sometimes even 4 to 6 hours after the cardio program that you've started.
Yeah, so hyperglycemia can also be an issue too, because especially at the higher intensities, because what happens with the hyperglycemia is that intensity increases for the exercise. Um, Once your body has used the glucose that's already in the bloodstream, then it also gets some of the glucose from, like, your muscles and your liver also release glucose into the bloodstream to fuel that higher intensity exercise. And so that's the reason that we sometimes see increases in blood glucose, is because that glycogen is being broken down from the liver and the skeletal muscle into the bloodstream, and you just don't want it to get over 250. 250 is where it starts to get a little more risky, especially if ketones are in the urine. Um, but yeah, that's also a risk as well. And so if hyperglycemia does start to occur, like the American Diabetes Association, their general thought is you have to weigh it. Generally, the benefit outweighs the risk, like unless we're talking about like over 250. But for it to go up a little bit during the exercise session, that's normal. But in most cases, the benefit outweighs the risk.
Yeah. Dr. Brown, this is wonderful. I'm really learning a lot, and we talked about repetitions, sets, intensity, and starting an exercise program, and talking about how to manage nutrition. And this is great.
Good.
Moving on, I would also want to understand. So we have these elderly populations or people who have had long-standing type 2 diabetes, having some sort of disability or some sort of, maybe peripheral neuropathy or some sort of joint pains, that may affect their ability to exercise well or start an exercise program.
Mm-hmm.
How would you approach them, and how would you go about guiding them in terms of starting a program?
Yeah, sure. So if we're talking about safety concerns in general, I'll start off with general safety concerns for anybody with type 2 diabetes, and then I'll go into some of the more specific um, concerns of joint issues and neuropathy. So I would say for anybody with type 2 diabetes, I think it is important to have a conversation with your doctor before, if you're currently not doing anything at all and you're now ready to start an exercise program, I would have a conversation with your physician first. First of all, just making sure that you don't have any limitations. I know most endocrinologists or doctors that work with people with diabetes, they're saying, please exercise. But just check with them, make sure that there's no concerns for the higher intensity exercise, especially. And then other topics that you'll want to discuss with them before you start your exercise program is potential medication adjustments. Um, So exercise, including resistance training and cardio, is very good at lowering blood glucose. So if you're already on medication that is also very good at lowering blood glucose, that's where the risk of hypoglycemia comes in. If they're both hitting at the same time, you typically want to try to exercise when your medication's not working at its peak. And I know there are guidelines for physicians about having to sometimes modify the insulin dosage prior to exercise. So that's a conversation that you're going to want to have. And then exercise timing too. I know I talked a little bit about exercising before breakfast, but on the other end of that spectrum, it's typically not advised for people with diabetes to exercise late at night right before they go to bed, because you run the risk of nocturnal hypoglycemia where your blood sugar drops too low while you're asleep, and that can be quite risky. Um, Now, if we're talking about joint issues, and oftentimes from my experience with people that I've worked with, it's typically knee issues. And this is where it's, it can be really helpful to work with a personal trainer or a physiotherapist with this in this type of situation, because there are always going to be modifications to different exercises that you can do if you're
Mhm.
feeling pain. You should not be doing an exercise where you're feeling joint pain. What many physical therapists have told me throughout my lifespan is simple rule is if it hurts, don't do it. And now you do have to be able to distinguish between the pain from expected muscle soreness, because that's a part of strength training. So you have
Yes.
to be able to distinguish between what's that.
No, I was just saying yes, yes, you bang on. Like that's what we need to differentiate between. Yes.
Yeah. So muscle soreness is a normal part of strength training, but if you're feeling it in the joint and it's like sharp pains in the joint, that's not a normal part of resistance training. And so, depending on the exercise, you can typically change up the angle of what you're doing. Like if, like for a squat, for example, if I've got somebody squatting and they're feeling a pain in a certain area, I'll change up their foot position. It may relieve it. It may not relieve it. If it doesn't relieve it, we might need to do a different exercise that works the same movement pattern. So maybe like a leg press exercise. That way, all of the weight is coming down on the hips instead of the knees. And so they can do a similar type movement, but without experiencing that pain. So, where there are joint issues, you would need to have some of the exercises tailored specifically to your specific situation. And with neuropathy, like that's a it's a bit more of a it's a bit of a double-edged sword, because we know that resistance training, especially standing exercises, are good at reducing symptoms of neuropathy and also improving balance. But at the same time, if somebody has an open sore, then they have to make sure that they're not putting any pressure on that open sore. So if you're dealing with neuropathy, um, while standing exercises are oftentimes ideal, it's not necessary if it's, first of all, if it feels too risky for you, um, to do it by yourself. First of all, I would say if you don't have any open sores, if you can hold on to something while you're actually doing the movement, or if you're working with somebody, if they can hold on to you while you're doing the movement, that could be an alternative. Or just use machine weights, because the important thing is you want to feel safe and secure in the movements, because you can still get many of the benefits of resistance training from doing the machines from a seated position where it's not quite as risky. But if you are able to do some of the standing exercises with free weights, that could be really beneficial to improving some of your neuropathy symptoms. And you also want to make sure that you're wearing proper footwear. So if you have any prescribed shoes for neuropathy, definitely wear those.
Wow. This is great. So, Dr. Brown, can you also, we didn't talk about machine weights. I just wanted to understand, is there, um, some specific recommendations that, one person should be doing free weights versus machine weights, or it's more of a personal choice that somebody should be, going for one or the other?
Yeah, so the reason that there are most gyms that you go to, um, there's a ton of machine weights, right? And machine weights originated in a physical therapy session. And
Mhm.
when fitness clubs realized that machine weights, if you So the difference is like free weights are more technical, more skill based. They take time to learn. Machine weights, very easy. As long as you can follow a picture on a side of the machine, you're probably going to be fine. And so when gyms realize that they can save a ton of money by not hiring people to teach the free weights, they can just fill their gym full of machine weights because they're easy to learn. That's why we see so many machine weights now in the gym. And there are pros and cons to both. Um, with the machine weights, the cons are going to be a lot of the exercises do require some skill, some coaching, some time to develop those skills. Some are really easy. Some are more difficult than others. But the benefits of the free weights are because you're having to balance whatever you're holding, whether it's dumbbells in each hand. So if we're doing this from a standing position, I've got dumbbells in each hand or I've got a bar on my back, I'm recruiting a lot more stabilizers within muscle stabilizers within the entire body to balance and stabilize myself while I'm doing the movement. And so you're typically going to have more muscle recruitment. It could lead to more physiological benefits from doing free weights. But if you're new and you don't have a trainer, machine weights are a great way to ease into the gym. And also you can kind of, especially if you're not comfortable with the gym, it's just not something that you've done before or you've done very little of it. The free weight area can be quite intimidating. So starting off in the machine weight area just so that you get comfortable with everything. You can get a great workout with machines. And then potentially you might want to try to start incorporating some free weights. And I mean, if you've got the resources to hire a trainer or a physiotherapist to properly learn, that's a good option as well.
Very interesting. I am really surprised by the fact that the gyms kind of got machine weights to get rid of their fitness trainers so that they don't have to hire them. But that's a very interesting fact that I came to know about. Thank you for that.
Sure.
Um, um, Thank you for being here, Dr. Brown, and taking time for sharing your expertise. I really, really learned a lot. And I'm looking forward to, much more learning from you. And there's so much in this area that is still unknown. And
Mhm.
we explored a lot of it today. And before we say goodbyes, could you share a simple 3-day resistance training program for our audience?
Absolutely. Um, so I would recommend if you're first starting off, um, so for a 3-day program, have two separate workouts and you're just going to alternate between those workouts. Okay. So let's just call it workout A and workout B. So if you're training 3 times a week, let's say the first week, Monday, you do workout A, Wednesday, B, Friday, A, the next week, B, A, B. So you're just alternating between these two different workouts, even if you're doing 3 days a week. And so these are full body workouts, both of them, and they work all of the major movement patterns that I was talking about earlier. So for the first one, I would say do some version of a squat. And there are many different versions of squats that you can do depending on your fitness level. So if you've got limited mobility, you'll want to start off. And I will also say a lot of these exercises that I'm about to go over, I do have instructional videos on how to do them on my YouTube channel. So the name of my YouTube channel, it's called the Diabetes Resistance. There's a playlist on there called Exercise Instruction, where I give very detailed instruction on how to do each of these exercises, what muscle groups are worked. So it'll be a good way to start off. So you've got a squat. So you can start off with limited mobility, maybe a chair squat, an air squat, and then progress from there. Exercise 2 would be some version of a bench press, or if you're doing it from home and you don't have a bench, you can do a floor press. So it's basically a movement where you're pushing forwards. So that's a horizontal pushing movement. And I do have a floor press video. I know I have one of those on the channel. A lat pull down. So with a lat pull down, this is going to be a vertical pull. And if you've got a gym, they're going to 9 times out of 10, I've never been to a gym that didn't have a lat pull down. So you've got a machine there. If you're doing this from home, like I was saying earlier, get some resistance bands at a door anchor. So the door anchor goes at the top of the door, and you can just loop that resistance band through and do the lat pull downs there. I know I've got a video on that one. A side lunge is the next exercise. So this is another, so the squat is considered a knee movement. The side lunge is also considered a knee movement, but I like to incorporate exercises like a lunge. These are termed unilateral exercises, meaning that you're working one limb at a time. And I like these for diabetes because they promote balance and they promote stability. So it's a good way to train balance. And so with the side lunge, you're basically taking the step out to the side instead of forward. So I've got a video on lunges too. Frontal raise. So this is a shoulder exercise. So you've got, let's say if you've got a can or a dumbbell, you're just going to raise it out to the front like that. I think I've got a video on lateral raises, but frontal raises are just raising up to the front. So that's another vertical push exercise. Romanian deadlift. This is a really good one to learn with just your body weight first. I've got this one's considered a hip exercise. It's such a great exercise for training the back of your legs, so your hamstrings, your glutes, which is your bum, and then also your back muscles. So I've got a video on that one. I would start learning with just your body weight first, and then start to incorporate some added weight to it. And then the last exercise for that workout, so you always end with whenever you're structuring a workout program, you always start with the exercises that work the largest muscle groups first. So that's why I started off with squats, bench press. Like these are the legs and the chest and the back. Like those are all the big muscle groups. And then you gradually work down to the smaller muscle groups. So the last exercise for that program or for that workout is going to be either a Superman or a plank. So a Superman might not be as comfortable and so basically what a Superman is, you're lying on the floor face down, and then you lift your arms and your legs off the ground at the same time. That's not always very comfortable for some people. So you could also do a plank. And if you're new to doing exercises like this, you can start off with a plank from the knees. So that's just a modified way to do the movement. Workout number 2. So once again, starting off with our knee exercise first. So I've got forward lunges to start off with. So once again, we're training for that balance, but we're also working our legs. So you're stepping forward on a forward lunge instead of to the side on a side lunge. And then I've got a push-up for our second exercise. So once again, this can be modified depending on your level. Limited mobility, do a wall push-up. I've got a video for that. You would then progress to what's called an incline push-up. So once you've got the wall push-ups mastered, you then you push yourself off of a tabletop. So you're gradually lowering the angle until you're parallel to the floor. And then you can do modified push-ups where you're on your knees and then gradually progress to the toe push-ups. I would then say have some type of row exercise. The video that I have, it's called like Pendlay rows and bent over rows. But you're basically pulling backward like this. And so that's going to work so this is called this is a horizontal pull movement. So you're working your back, you're working your biceps, and that can be done with dumbbells. It can be done with canned goods, and you can also do it with resistance bands. Keep hitting this mic. The next exercise would be a press. So pressing overhead like this. So once again, with canned goods, water bottles, or light dumbbells. Reverse fly with that one. It's going to hit your upper back and you're bent over when you're doing it. And I would use really lightweight with this one. I've got a video on that. The hip exercise for this workout would be some type of hip abduction. And what hip abduction means is your leg is coming out to the side. Let me see if I can stand up and show you real quick. Ugh. Can you see my hips? I can't really see my photo right now.
No.
No?
I mean,
Okay.
I think if you step back a little bit, maybe just a little bit. Yes.
Yeah, maybe. So like, all right. So some form of hip abduction, if you've got, once again, if you have limited mobility and you really need to be working on your balance, find a stable structure like a table that you can hold on to when you're doing this and just do those out to the side. That way you're strengthening your leg, you're working your hip muscles, and you're also promoting balance. You can also do these. Do you remember Jane Fonda workouts? Jane
Yes.
Fonda, yep. So you can also do these from the floor, laying on the side. So hip raises, you can attach if you've got like ankle weights, so you can increase it that way. And there's if you're at a gym, there are those machines that you sit in, and both your legs go out to the side like that, and you can also pull them into the side as well. I would then include a calf raise or a heel raise. So you're focusing on coming up on the tops of your feet. That can also help promote balance while at the same time you're targeting your calf muscles a bit. And then the core exercise at the end would be an abdominal crunch. So you're just focusing on crunching up or curling up from the floor. So those would be my two workouts that I would alternate between.
This is great, Dr. Brown. I'm really, really uh, thankful for you for being here and giving us such beautiful insights on the whole aspect of resistance training. And this workout program is really, really going to be beneficial for a lot of people out there. With or without diabetes doesn't matter, even for myself, and I can imagine like my parents and everybody. Like if we start these programs and just build ourselves up, I think overall well-being is going to be, much better. Thank you. And any last words before we close it?
Oh, just thank you so much for having me on this show. I really enjoyed being able to talk about all this work that I've been doing, and these are the types of things that excite me, and I enjoy talking about it. So, thanks for that opportunity to for me to share.
Thank you. Thank you for being here.